The National Patient Experience Survey is the largest healthcare survey in Ireland. For the second year of the survey, just under 27,000 people were invited to tell us about their experience, and 50% responded. A similar number of males and females responded. Responses were received from all age groups, with the highest response rate of 54% from patients 66 years of age and over. 75% of respondents were an emergency admission. 40 public acute hospitals across Ireland participated in the survey. Patients that spent 24 hours or more in a hospital and were discharged in May 2018 were invited to participate in the survey. The survey asks about all stages of care from admission to discharge. Admission asks about patients' experiences in the emergency department, such as waiting times and respect for privacy. Admission overall rated 7.9 out of 10. Care on the ward asked about experience on the ward, including communication with hospital staff, privacy, pain management, cleanliness and food. Care on the ward overall scored an average of 8.3 out of 10. Examination, diagnosis and treatment asked about patients' experience while undergoing or receiving the results of tests, treatments, operations and procedures. Examination, diagnosis and treatment had a rating of 8.2 out of 10. Discharge or transfer asked patients about their experience relating to discharge, such as sufficient notice of discharge and the provision of information, advice or support. Discharge or transfer had an overall rating of 6.9 out of 10. Overall, 16% of respondents had a fair to poor experience, 30% had a good experience, and 54% had a very good experience. Males had a better experience than females. 51 to 80-year-olds had the most positive experience, whereas 16 to 35-year-olds had the poorest experience. Respondents that were not emergency admissions had a more positive experience overall. Overall, the areas of good experience are cleanliness on the wards, being treated with respect and dignity, being given privacy when being treated or examined. The areas that provided the greatest challenges were the ability to talk to staff about worries and fears, not adequately being told about the side effects of medication. Patients said that they were not always given sufficient time to discuss their care and treatment with their doctor. Thank you to everyone for your support.